Today we're going to talk about herpes and how it can affect your newborn baby. Herpes is a virus that can be transmitted to your newborn infant during pregnancy. About 85% of herpes can be transmitted when you deliver vaginally. And postnatally, when the baby's out, a baby can be affected by herpes when someone who has mouth sores or cold sores kisses the baby, and that can be a source of infection. Now, herpes, about half of the babies affected show symptoms on their skin, eyes, and mouth. This is what we call mucosal infection. And then they can also have central nervous system effects. And then if the herpes virus gets disseminated or affects the whole body of the baby, they can present symptoms of respiratory distress. Their liver can also be affected. Now, what are the symptoms of herpes virus on babies? So we usually see, like, within 2 weeks or until 6 weeks, symptoms like skin rash or vesicles. You usually see like vesicles, like a group of rash, and then some babies would have fever. If the eyes are infected, there can be eye redness or watery eyes. And if a baby's lungs are infected, then they can present with respiratory distress. They can be breathing a little fast than usual. And if the infection goes to the central nervous system, then the baby can have poor feeding. They can also have lethargy, not very active. And then for those other babies, they can have or present with seizures. So how do we diagnose this one? We do some blood tests. We call it, we can send for complete blood count. We can also check the liver if it's infected, like the liver function test. We do skin swabs. We check the skin, the eyes, the anus. We swab those places and the mouth of the baby, and we send them to the lab for testing. We also do a viralculture to make sure that it's really herpes. We also do an eye exam. We call for ophthalmology just to have a subspecialist check the eyes of the baby. And if the nervous system is affected, we also do what we call a spinal tap or lumbar puncture. All these things are done just because herpes is really a nasty virus, and we want to be proactive when managing this infection. Some babies will require what we call EEG to check for seizures if they're presenting with seizures, and some head imaging in the form of CT scan or MRI. Now, how do we treat these kids? We give antivirus medication, and usually the duration depends on how the clinical status of the baby. So about 10-14 days. Some babies will need longer treatment if the symptoms are more severe. So prevention wise, we really would talk to the OB. For mommies who have active virus rash or herpes rash, you probably need to have suppressive medication so that when you deliver normally, then the baby's risk for infection is lesser. But even with suppression of viral medication does not guarantee that your baby won't have herpes. So just be careful out there. Again, herpes is a nasty virus. Mommies, when you're expecting to deliver vaginally, talk to your OB, and you talk about suppression. That's it for today, and thank you for being here.